Welcome to the On Your Mind podcast, where we are changing the mental health narrative, bringing hope and solutions. Here's your host, Timothy J. Hayes, psychologist.
Patrick Alonso is a catalyst for change in healthcare, driven by an unyielding commitment to progress. As the force behind Tampa Healthcare Advocate, he fearlessly advocates for his clients' health and well-being, leveraging his expertise as a licensed Florida pharmacist for health and wellness. Patrick loves to help others, and his passion for healthcare change shows in his work as a pharmacist advocate for his clients and the profession of pharmacy. Well, Patrick, thank you for joining me today. It's delightful to see you face to face.
Timothy, it's an honor to be here, and I really appreciate the work that you do for people with health and wellness, especially with mental health.
I'm hoping you could start us off today by telling us a little bit about how you got into the work you do and what drives your passion for it.
Sure. So I'm a pharmacist by trade, went to pharmacy school, passed my boards, did all that good stuff. But I left, I guess, the world of what you would traditionally call a pharmacy practice. So where somebody might be in a hospital or in a big box retail store, things like that. I practiced in that setting for a little while. And I kind of have some prehistory with polypharmacy, medication errors, and things like that when dealing with my grandparents. And I really helped take care of them towards the later years of their life. And what I found was that a lot of people just kind of are very accepting of the medications they take and the healthcare that they're receiving. And for the most part, it's probably pretty good. But some people just need a little bit of extra help. And so I left traditional pharmacy practice to become a healthcare advocate with a pharmacy focus, just because the United States is one of the most prescribed countries in the world, if not the most prescribed country in the world. We have some of the highest rates of polypharmacy, which means taking 5 or more medications. And I just really wanted to hone in my practice on helping people. I really like helping people one-on-one. I do like helping larger groups, but really changing the way people kind of use their healthcare has been a real passion of mine. And it kind of stems from some issues that my grandparents had in the healthcare system, where my grandfather, for a good example, he was prescribed a beta blocker from his primary care, and he was also prescribed one from his cardiologist. They did not have a communication system that worked, so he ended up on double beta blocker therapy, which, if you don't know, can be pretty debilitating. He had a hospital stay. And this is before pharmacy for me. So we were all kind of confused. We didn't really know what was going on. Why are the medications that my grandfather's been given to help his heart failure hurting him? And so that kind of, this and other things were kind of a driving force for me to go to pharmacy school. And once I got to pharmacy school and I started practicing, I realized that my grandparents' issues were not in isolation, that many people had experienced medication errors, and many people did not feel like they were getting the most out of their healthcare or getting the most of what they paid for. And so when I was in that practice, I realized I felt like I could help more people starting a business where I could practice pharmacy the way I wanted to. I don't dispense. Think of me as the pharmacist as like tries to help you get off drugs or manage your drugs. And so that's really how I got into starting a healthcare advocacy company.
And so, can you describe for us what your role is like as a healthcare advocate? When you meet with somebody, what's your part in the healthcare process?
Sure. So that's a great question. So the main thing is, usually when somebody comes to me, they're not having the greatest situation, right? Like, I'm probably going to have to fix a lot of problems from the get-go, which is fine. That's kind of why I started this business. I'm a problem solver. I like fixing things. So usually when somebody comes to me, I'll just say, in general, they're somewhat disorganized with the healthcare system, the paperwork, the doctors. Chances are they have 3 or more docs or prescribers. So that can kind of cause some issues if they're not in the same health system or communicating. Generally, they don't remember the last time they had some lab work, don't remember the last time maybe they had certain, needed procedures, like if they are a cardiology patient, they probably need an EKG at some point in time. And so a lot of these factors are just kind of all over the place and strewn about. It's pretty much my responsibility for when somebody retains me to help organize all of that healthcare information, find out what they need and what they don't need, be an advocate for their health first and foremost, and for them as a patient, and then really start working on if they're on medications that they don't necessarily need, if they're on too many, if they're not on the right therapy, if they're being charged a bunch of money for one drug that a different drug is on their formulary for their insurance that would be a lot cheaper but offer them the same relief or benefit. So those are kind of things I really go through someone's entire healthcare. I try to save them money. I try to save them time, stress, all of the above. And when you have somebody kind of like looking over your shoulder and really helping streamline the process, you realize that a lot of my clients they're already sick and tired. They're tired, right? Is more so than anything. And so getting them to a point where they don't feel as tired with all the extra that goes on, they can actually focus on their health. They focus on eating better. They focus on their exercise. They're not so exhausted from all these visits and all these text messages and notifications coming to them because I'm helping them handle it.
So is it a process of you having them sign a bunch of release forms so you can start interfacing with their other healthcare providers, or is there another way you go about that?
So I do both, and it's really depending on how comfortable the client feels. A lot of times I just go to the doctor's appointment with them. I establish the relationship. Hey, I'm the healthcare advocate. If we need like a HIPAA release, we can sign it. I have those at my office. And I've noticed that a lot of times when I'm more involved and engaged, then their providers are a lot more involved and engaged with us. And so there's a lot more communication that goes on, which can be really helpful for a patient. Like, let's say they don't need maybe a full visit, but they're just having a question about something that's going on. We have a line of communication open. And so it kind of goes any route that the patient feels comfortable. So a lot of my clients like me to go to their doctor's appointments with them. Some of my clients don't live in the state of Florida. I have some in different states, and I'm like Spacely Sprockets at that point. If you remember the Jetsons, where they'll just put me on their phone and I'm there at the visit with them. So that kind of gives me the ability to be more hands-on with their providers, establish that, hey, there's a pharmacist looking after their medications. There's someone continuously monitoring them, and that I can communicate with them pretty openly if something isn't right or if we have a question about what to do next.
So the first thought I had when you said when you're there in the room with the patient as an advocate, their other providers are more engaged. And the first thought I had was, isn't that a shame?
Yeah. And I'll say it's like this. So most of my clients come to me and they say, "Hey, I go to this doctor. I think they're a pretty good doctor, but whenever they talk to me, they're on their computer the entire time." So it's like they're typing away, the patient's over here, like let's say, pointing to my right now. I'm facing my computer and they're just typing away and they're asking questions. And so the patient is kind of feeding information into their ear, but we've kind of lost some of the direct eye contact, like you and I are kind of doing, virtually.
It's called engagement, right? It's
right.
Being engaged.
And I feel like a lot of people get treated, and healthcare is very segmented, right? Like you have neurology, cardiology, pulmonology, like all of the different specialties, which are great because having really intelligent people hyper focused on something, they can get a lot done. But if it's one appointment and another appointment and another appointment, every single doctor isn't paying attention or they're not engaging, right? Looking at them, asking thoughtful questions. It's just like, hey, let's check the boxes and get out of here. And I'm not saying that that's what doctors want, but insurance unfortunately puts, I think, a lot of providers under constraints that they don't like being under. They like spending time with their patients. They like helping. Anyone who went to some kind of healthcare professional school or program, you did it to probably help people. And then you get out in the real world and now there's all these confinements on how you're going to practice, and it really sucks for a lot of them. So By me being there, I'm able to answer questions. I'm able to kind of break a little bit of that computer just listening, and we get a little bit more engaged in the conversation. And
Well, and I would imagine that you also ask questions that the patients may not think to ask.
absolutely, there's been many instances where, I mean, how many people know have as broad of a knowledge of disease states and different issues as a healthcare provider or a pharmacist or somebody? They don't maybe have that type of knowledge. And so when they get a new diagnosis, when they feel like something isn't right, maybe they don't know how to ask the questions or speak the language that us healthcare providers are speaking. So it's my opportunity to kind of intervene there, positive intervention, and really open up the door for my patients to get some answers that they need.
So I'm in prepping for this interview, I was this one question kept coming to me. I wonder if you, Patrick, have some uh, fundamental questions that you or techniques you could give our audience to say, look, start with this. Make sure you ask this. Here's a pattern of information that's usually not disclosed. It's really important for you to know. Are there some tips or tricks that you could mention for people to help them at least increase their awareness that they might need an advocate, or help them advocate for themselves if they're not in a position to hire an advocate?
Sure, Tim, that's a great question. And I'm happy to kind of provide some tips and tricks for your audience. So, number one, be organized, show up on time, right? That can be very difficult for people for various reasons, right? Transportation, communication, just feeling overwhelmed, right? So that's a good number one. It probably seems obvious, but it's one of the things that I deal with the most. Number two, keep an updated list of your medications, and this is the pharmacist in me coming out. Keep an updated list of your medications on board for any of your doctor's visits. Edit it. So if you switch something out, um, all that, make sure that the name of the medication that you take is on there, the dosage form, and how many times a day that you take it. That's great for every provider to have, and something that comes up all the time when I'm newly retained for a case is, if somebody has generally 3 or more providers, I will go to every single one of those appointments, or I will fax them a new medication list or request a medication list to check it. And chances are one of the 3 will not have an updated list of those medications, or the most recent list. Sometimes all 3 don't have an updated list. Like if I'm talking to the client or the patient and they have all their medications and supplements in front of me, it might not be updated from what I see. So I go through and update everything. So keep your medications updated. That will probably save a lot of people a lot of time and hassle trying to track all those down. And it puts you at a much safer place because now your providers know what they can and can't prescribe you based on what you're already taking. I would keep at least your 2 most recent blood works, at least somewhere accessible. That way you can kind of see your progress. So like, is your A1C going down? Is your A1C going up? And that gives you a good place to be able to track health information as well. So having those are the big 3 right off the top, where show up on time and ready to go, have an updated list of medications, and have an updated list of, or an updated lab work. That's a really great start. Any additional health information that you can provide a doctor greatly helps their ability to be able to interact with you and to be able to kind of give you the right diagnosis and the right treatment.
So have you had a situation where there's someone you're advocating for or with, that the patient who is well organized and has a nice history outlined, and they get the feeling from their provider that the provider's not even reading what they've given them?
Absolutely. I actually was hired recently for something similar. And it was kind of strange because we went to the appointment and we had the health discussion. It was to a cardiologist. And we leave, and I thought that wasn't really that bad, right? Like, hey, a pretty good appointment. We got our information across. They asked thoughtful questions. They were very engaged. But when we're in the elevator going back to our cars, the client said, they've never been this nice to me before. They've never been this engaging with me before. Usually, like I said before, they're just typing on the computer. And really, I didn't do a whole lot of talking. I didn't do a whole lot of interacting, but sometimes having someone there is really helpful. And it doesn't have, I'm a professional, right? It doesn't have to be, it doesn't have to be a professional. It can be a family member or a friend, someone that you just feel comfortable with, that you feel like can kind of be a rock for you there in that doctor's appointment, is so important, because then you have a support system in place, and it doesn't feel so much like you versus the doctor, or me versus the doctor, right? It's you and your friend or family member or professional and the physician, and everybody's common goal is the patient.
Again, I say I wish it didn't have to come to me hiring somebody or bringing somebody else in for my provider to tune in and engage with me. But then, if that's what is happening a lot these days, and as you mentioned, a lot of it's because of the pressure that providers are under from the complexities of the system and the insurance and all the paperwork. So uh, it's good to have an advocate there, as you say, whether it's just another family member or a professional, to help get things a little bit more engaged, a little bit more actively monitored. And then the next thing is, what's your understanding of, and or how difficult is it to get a provider to help you uh, de-escalate the process of increasing the number of prescriptions? How do you help get people or providers on board with winnowing down the number of prescriptions that a person's on?
Sure. So that's like a really great question. And I think anybody can really do this, right? There's a special skill and technique that a pharmacist would have. But the first thing would be to go through the list of medications very thoughtfully. And what I would do as a pharmacist is I ask, hey, when were you prescribed this? What doctor prescribed this? What were you prescribed this for? And sometimes you can go through the list, and sometimes they're appropriate. The patient needs them. You look at the lab work, you look at the past medical history, it looks like it fits. Sometimes, and this is really a lot of polypharmacy, will be I was prescribed this medication and then not realizing that there is a side effect associated to the medication. So I was prescribed this, I was experiencing this, and they thought it was maybe a new illness or new issue or disease. And then they go see another doctor and they're like, well, I'm just kind of feeling like this, XYZ. And they'll say, well, we'll just prescribe you this for it. And so that's kind of how the polypharmacy can get started, is that you're prescribed one medication and then you're prescribed another medication to treat the side effect. And then that medication can have a side effect, and then they're prescribed another medication for that side effect, and it goes on and on.
Now, let me interrupt you there, because you're
Sure.
using a term that's a side effect, right? And my experience has been that that's just semantics. Because if I have an effect when I take a pill, it's an effect of that pill.
Right.
And if somebody says, I like this effect, so we'll call it a main effect, and I don't like that effect, so we'll call it a side effect, it's just semantics. So what you're
Right.
saying is a lot of polypharmacy happens because I start to have unpleasant effects when I take a medication, and then a doctor, maybe a different doctor, prescribes me medication for the effects, try and counterbalance the effects I have from the first medication.
Right.
And then that can snowball.
It happens a lot.
Wow.
So, yeah, so side effect is semantic. The undesired effect of a medication would probably be a better term.
Yeah, it's an effect. It's an effect
Right.
I don't like.
Right. So, that's a really great way, is to find out which drugs were prescribed for side effects, which drugs you actually need. I mean, you can kind of knock out some things there. Another thing is this is where kind of having your lab work and being on top of health information is. If you're noticing that your A1C is dropping, let's say you've made, healthier lifestyle choices and things like that, and the A1C kind of starts to go down. Like I'll say last year, one of my first patients that I ever had here with this business started with an A1C above like 7.8. So he's creeping up on 8. We just made a couple lifestyle changes and his A1C really started to go down safely. And that's when we lobbied for, hey, can we reduce this dose? Can we get off this medication and just see if the A1C stays? And we were able to get him off most of his medications. And so being able to be on top of lifestyle, diet, those kind of things, and keeping track of that health information, tracking those numbers is very important. And also determining if a medication was prescribed appropriately for an actual disease state or an undesired or side effect of a medication.
So, what percentage of people that you advocate for would you say are experiencing, I think you said 5 or more, you call it polypharmacy if it's 5 medications or more. What percentage would you say are that you're dealing with have that?
100%.
100% of the people that ask you to advocate for them are on 5 or more medications?
Yes, that's partly geared towards my specialty as pharmacy. So I really kind of try to help people the most. I feel like that's the most in my scope of practice is helping them with their medications and reduce unwanted effects or a hospital stay.
So how would you what do you know if you have numbers on this about how many of those you're actually able to assist in getting reductions in their medication or in their numbers of meds?
So I would say that I've been anybody who's on about 5 or more, the more medication, I hate to say this, but the more medication somebody's on, probably the more I can help them realistically. But 5 or more, generally we can kind of reduce the dose on one, change up something to make it work a little bit better. We can kind of alter it just a little bit, or sometimes they're just unneeded medications, or I'll give you a couple of great examples, like digoxin's one that's really kind of fallen out of favor. If somebody has AFib, they've been on this for a long time, their heart's under regular rhythm, they might be able to get off that medication free and clear.
And
So they're
what's the name of the medication again?
digoxin. It's a medication for AFib.
Okay.
So now, like just with better anticoagulation, right? Those medications have gotten much better, much more refined. And the heart rhythm and heart rate medications are just a lot better. Digoxin's a really dirty drug. It can cause issues with kidneys, especially in our older population. So that's just something that if one of your listeners is on it, they go talk, please don't just stop taking it, but go talk to your cardiologist about your heart and see how your rate and rhythm has been over time. They might be able to discontinue it because that medication has just fallen out of favor. And there are a lot of medications that have been on, somebody's list for a really long time. And there might be a newer, better medication, or the old medication has just kind of fallen out of favor with the guidelines. And it's really no longer needed as long as they're, meeting the certain criteria.
Well, that's an excellent point that I don't think a lot of people understand, is that there can be a standard recommendation for a medication, and then a number of years later, they might uncover that, the longer we use this, the more we're seeing problems with it, and so it's no longer the primary recommendation. But if you're not staying on top of it, your doctor may not catch that.
Right. So usually, and this kind of goes back to your original question, is how do I kind of help lobby for people to reduce or discontinue or to change doses of medication? Well, first of all, I don't pull it out of thin air. I usually go to certain guidelines. So there's treatment guidelines that a lot of healthcare professionals use to determine the course of treatment. So I use some databases here at my office where we'll kind of go through typical treatment algorithm. And then we'll also go through the most updated guidelines. And we'll use evidence and evidence-based techniques to determine if that medication is right for that person, or if they're no longer a candidate for it, or if there's just something better out there for them, assuming that they can afford it or need it. So there's a bunch of different ways that we can kind of tackle these issues, but they're all evidence-based, at least coming from me. And it's just very much so, I just like to provide that kind of resource for my clients. Just in case something happens, a new drug comes on, we're aware of it, we're on top of it, and we can kind of, in using those techniques, we can also help mitigate side effects.
Well, I don't imagine I've asked you every question that you'd like to get out here. So if you take a minute and just get centered and think, okay, so here's what we've talked about so far. What is it I haven't even mentioned, or one of the things we've already talked about you want to go back and highlight for people?
So I would really like to talk about nutrient depletion. And this is something that I've become more and more passionate about in the time I've owned this business, because I've realized that it is much more of a common issue than healthcare, the healthcare field in general gives it credit for. So I'll give you a perfect example. Um, I had somebody very early on in my business contact me with rheumatoid arthritis, and they were taking methotrexate. I'm not trying to call out any drugs or anything, but these are just facts and stories. So they came in, they're like, hey, I got diagnosed with rheumatoid arthritis. I was okay on the medication for like 3 months. And then I just crashed and I felt like crap. And I have not been able to do the things I like doing. My flare ups aren't as bad, but I just feel like crap all the time. So it's like, what's worse, right? Feeling like crap or having a really bad flare up. And that was their opinion, not mine. So we kind of started going through their supplements, kind of what their diet and lifestyle was looking like. And then you realize methotrexate is one of those drugs that absolutely destroys B12 stores and B complex stores in the body as one of the undesired effects. So what we did was just kind of get her on a really nice B12 or vitamin B complex supplement with, some additional B12. And it wasn't super expensive. I think it was $9 on Amazon. So, nothing, we're not getting reinventing the wheel or anything like that. And within 2 weeks, she felt better. And so it's really making sure that a lot of times maybe one medication doesn't completely deplete your vitamin stores like methotrexate does, but maybe a combination of drugs does, right? A lot of the seizure medications will deplete folate, but as you may know, folate has a correlation with mental health issues. So a decreased amount of folate can increase depression or anxiety. So realizing that, hey, some of these like I'm feeling like crap, I'm feeling depressed. Well, you're on XYZ seizure medication that depletes folate. Let's get you on a nice folate supplement, right? And so giving people kind of some additional nutritional support that they might not be able to get for whatever reason, or just it's not in their diet or whatever, being able to give them that really helps, because now it's kind of helping the medication work while also mitigating the undesired effects that come from nutrient depletion or nutrient imbalances that medications or treatments do cause. I have a really great database that I use. It's kind of about natural medicines and things like that, but also about prescription medications. And the focus is to determine if a cocktail of medications or a single medication is depleting somebody's nutrient stores, which can make anybody feel like crap or lead to other diseases. So kind of stopping that in its tracks and giving people a fair shake at good health and feeling better is really something that my business is built around.
Excellent. Yeah, that's something that I still remember the first time I went to a doctor with my mother and they were prescribing an antibiotic. And when I raised the issue of a probiotic or prebiotic or both, the doctor said, excellent, and here's the one I would recommend. I still remember the first, it was shocking because I was used to having to fight them because they would say there's no reason for that. That's a waste of your money. Don't do that. So it's good to know there are people like you that are coming out and saying, okay, look, there's actual very powerful impacts from these medications. And a lot of them are not the ones we'd like to have. These are the undesirable effects of these medications. And yet the desirable effects might be important for people to, like you say, with the rheumatoid arthritis. Maybe I'm having a lot less flare-ups, but what if I have no energy? And if you can supply some supplements or boost their intake of different, high quality foods, that's just delightful to hear that you're in that you're focusing on that as one of your primary areas.
Yeah, I actually had somebody tell me the other day, they came in just I offer a 1 hour free consult to anyone who comes to my office, wants to Zoom me, anything like that, because A, I don't feel right charging somebody if I can't help them, right? Um, and that's really important to me. So being able to help somebody, first of all, so I give everybody a 1 hour free consult. You tell me what's going on. I say I can or cannot help you, and here's probably some areas that I can help in. Um, that's one of the really like great benefits of it. But also is that usually I can kind of bring up, just with my training and experience, I can bring up other places in someone's health that they weren't even thinking that I could be a benefit of. And so and that's part of me just advocating for the profession of pharmacy. I think that we're way too skilled and have way too many benefits to our education and training, that a lot of it's just being left in a big box store. And the pharmacists at those stores are all, I have many friends that do that. They're great people. Believe me, they really want to help. The problem is, it's just like providers with insurance. Corporate metrics are suppressing their ability to be able to spend as much time as they want with their patients, saying you have to do this many vaccines in a day, you have to get this many drugs off the shelf in a day, you have to do this many orders and all this kind of stuff. And there, as far as I know, it could have changed. But when I talk to my buddies in those retail pharmacy spaces, they don't get, there's not a metric that says how many patients did I help today? How many
Right.
patients did I counsel? Right. And so if there was more of that, I mean, I probably wouldn't have a place for me. Right. But just if there was more of that, to be able to say, hey, can I talk to you for a few minutes? And any pharmacist will. Right. But, some people don't want to wait. They don't want to wait the hour wait to get to talk to the pharmacist or come back or whatever the case is. So it can be really difficult to get an accessible healthcare professional. And I say, as an advocate of the profession of pharmacy, generally, pharmacists are the most readily available healthcare professionals you can get. You can walk into a pharmacy, hopefully it's not super busy, and you can talk to a pharmacist pretty quick. At least you can get some questions answered. So, and they might be mad at me for saying this, but it's also, relatively free, right? Like, you can go up and say, hey, I pick up my drugs here. I have a question about this medication. They'll answer it for you. So it's a really good tool to utilize that a lot of people, I just think, don't know about.
Yeah, I agree. I have for a long time recommended that my patients go ask their pharmacist because they have a much harder time getting back to the psychiatrist or getting a response from their primary care physician's office. So, and usually a time sensitive issue with the medication. So, well, if you would do that one more time, take a breath, think about everything we've asked you, you've talked about, and decide if you want to go back and highlight something or throw something new out on the table before we wrap this up.
So I have one more thing that I think is really important, and this kind of goes for everybody. Is I'll just start. So something that is very important to me in this career, and kind of in the profession of pharmacy, and I'm kind of working in two different worlds. Something that's really important to me is, and I see this, I mean, this is almost everybody I'm working with or dealing with, is that patients, chronic disease and these kind of issues really debilitate people in ways that we can't imagine. And what I'm saying is that generally they're very sick to some degree, which they might not, it's not your typical flu-like symptoms, right? Like, oh, I have a fever. They're just exhausted. And while I would say that our healthcare system is fantastic, there's new drugs, there's new treatments, there's a lot of new, very innovative, very helpful things. Like, let's take cost out of kind of the question, right? Let's pretend that cost really isn't a barrier. We have some really awesome stuff, awesome modalities. The problem is that sometimes to access these modalities, it takes a lot of work to be able to just, you got to shovel through crap, for lack of a better term, and you sometimes have to shovel through a lot of it. And when people are sick and tired, that shoveling is even more difficult. And to degrees that we can't imagine, right? And so kind of having just a little bit of a boost. So this kind of goes anybody who has a sick family member or a friend or something like that, and you're just sitting there rooting for them and you're like, why aren't you doing this for yourself? Like, why aren't you doing this? It's because they're exhausted. And a lot of my clients are exhausted, and I try to give them new life and I try to give them that energy back. So I shovel the crap. And so, but if you have somebody in your life that could use a little bit of help, don't be afraid to get your hands dirty, do some shoveling, because it can really change the trajectory of their health and the course of their life just by giving them a hand. So it doesn't have to be a professional. I'm a professional, but just being there for your loved one or your sick family member, your friend, whatever the case is, helps them so much get through the really difficult times in life. And while we might think like, oh, it's just a couple of pieces of paperwork, to them it probably feels like a 1,000-page book that they have to go to when it might only be 3 pages. And just think about that. Be considerate of the people who are, dealing with some of these chronic health issues, and lend a hand. You can always call a professional, but you have no idea when somebody is really not feeling great or has chronic issues, making them feel like 2% better, 3, 4, 5% better is such a huge impact on their life and their health. Like a healthy person might think, well, I feel 5% better. It's not that much. When someone is chronically ill and they feel 5% better, it's like huge. And so I think it's just important for people to kind of just take a second and realize that helping somebody just feel a little bit better, taking something off their plate when they're really struggling, is just a massive benefit. Whether it's sick, whether they're, going through a mental health issue or a family crisis or something, but just if you have it in you to kind of take a little bit off their plate and help them for a minute, it can have such a massive impact on their life. And that's why I think that this profession for me is so important, because I get to do that almost every single day for people, and watching them just like watch the stress come off of them and watch them feel better is just so, so important. So that's really something I kind of wanted to kind of stand on, because it's not always the drugs. I mean, I clear up somebody's medication list in a couple of days, right? We can get new prescriptions, we can do all this, but it's that long-term me taking the stress off their plate so that they can focus on them. That's really the great like personal return that I get out of this.
Excellent. Excellent. Well, if people want to reach out to you, what's the primary way you'd like to have people contact you?
So you can give me a call. My phone number is 813-534-0293. That goes directly to my phone. It's my business line. Or if phone is good, or you can just email if you want to ask me some questions. If you hear about me on this show, and you just want to ask maybe about some questions, we can set up a Zoom call, or you can just email me and ask. I'm pretty available for that. I check my email a few times a day, and that's Patrick, Patrick, at tampahealthadvocate.com. And I'll send that to Tim so he can put that in the description.
Excellent. Well, I thank you very much indeed for taking the time to be with us, and thank you for the work you're doing. It's great to hear that people like you are out there.
Thank you, Tim. I think there is a growing community of us. I saw that there's a pharmacist. I think she's either in South Carolina or Georgia. I connected with her on LinkedIn, and so she kind of took up a similar role in a kind of a similar circumstance, I guess, that kind of drove her to this. So there are pockets of us where there's, pharmacists or nurses, or I think there's even some docs that are leaving their field and getting into advocacy and patient navigation, because it's so important. If the bridges are broken, it's tough to get anywhere.
Yeah.
So there's a lot of us that are doing it. I think it's kind of a new kind of concept that's coming up. And there could be 100 of me and there probably wouldn't be enough, but the more the better. And just really appreciate that people are out there realizing that there's a space that needs to be filled and that they're filling it.
Well, thank you so much. Appreciate what you're doing, and it's great to hear from you.
Thank you. Same to you. And can't wait for this to come out, and I'll definitely share it on social.
Patrick Alonso is a catalyst for change in healthcare, driven by an unyielding commitment to progress. As the force behind Tampa Healthcare Advocate, he fearlessly advocates for his clients' health and well-being, leveraging his expertise as a licensed Florida pharmacist for health and wellness. Patrick loves to help others, and his passion for healthcare change shows in his work as a pharmacist advocate for his clients and the profession of pharmacy.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.